Um, I just have to do like a 15-minute interview if you can about your major. That's it. And what you do
About my major.
exactly.
Is it about my psychology?
Yeah, psychology.
Sure. Okay. Okay.
All right. Is it okay if I record you? Like, that's fine, right?
Yeah, that's fine. Doesn't bother me.
All right, excellent. Can you tell me what's your current job and the title or position and how long you've had it so far?
I'm currently working as a family reunification specialist. I've been working there since August of this year.
Sweet. So, what is it exactly you do there?
Basically, we work closely with the child's welfare foster care or other primary caregivers. And so, once these children are legally reunified or have the option to be legally reunified with their parents, we go into the home and provide them with therapeutic services, such as parenting skills, engaging in bonding with the children, substance use counseling, anything that really the parents identify as needs in which they would like to work on to further assist them with the transition of being reunified with their children.
And how did you land this job? Like, was it hard to get to this job where you are now?
It was pretty difficult. There's not a lot of openings out there in regards to the mental health field. It's pretty competitive. As far as how long it took me to get this job, I applied everywhere.
Okay, that's really cool. Like, I figured it was gonna be a hard job. A couple of people that did do an interview with did tell me that it took them like 8 years maybe in college, maybe a little bit longer. How long did it take you?
Yeah, I actually I went to college, got a bachelor's in psychology, worked as a case manager, and decided that I wanted to pursue my education further. So I went and got my master's. So total, I've been in school for 7. I was in school for 7 years.
Jeez. Do you work right now currently in a team or independent environment?
A team environment.
Cool. So you guys do like lesson plans or something, or no?
We kind of feed off of one another. We have staff meetings, and so we discuss different techniques that can be used with the families that we're working with. So we kind of just feed off of one another.
Awesome. So, what do you like least about your job from everything you do and your experience every day?
The things that I have a couple of things that one of them would be that I don't have a set schedule. Most people have their 9 to 5, whereas I'm kind of all over the place throughout the week. I accommodate my schedule to the schedule of the families so that I'm able to see them. So it can be kind of stressful trying to figure out your schedule every single week. The other thing is, the field in which the area in which I'm working with, it's kind of hard to see these children and what they've had to go through, and some parents just aren't as receptive as other parents in the process of the reunification, and often some of these kids are taken out of the home again.
Wow. And what do you enjoy the most out of your job when you do work?
I would probably say just being able to interact with the families and the children. I mean, knowing that even if I'm making just a little bit of a difference in each of their lives, is really rewarding to me, as well as just having a team that's easy to get along with, and it's just pretty much a fun environment to be there every single day.
And how does it impact your work? Like, meaning working with others can be challenging, supportive, or helpful in anywhere, or you feel lonely at one point for these people?
I think in regards to the field that I'm working in it can be kind of challenging. I mean, in the sense that not a lot of people understand what we do. So when you're wanting to have that moment to relax and talk about your day at work, not a lot of people understand what is it that we exactly do on a day-to-day basis. So it's hard to just express yourself to other people, such as friends or family, because they're just not on that level. They don't really see what we have to see on a daily basis.
Okay. Is there anything else you'd like to tell me about your job or how you got inspired to do this?
Well, I mean, I primarily got inspired to do this because I felt like, my interactions and dynamics with my family weren't necessarily the best. And so I felt like if I could be a part of something bigger and interact with families and children and help them be able to better communicate with one another, then I was making some kind of a difference. So I guess my own family issues and my own family dynamics were what really inspired me to and interested me in the field of psychology and mental health.
It does make sense. A lot of people say that family and growing up in a broken home makes you choose the career you want. And some people told me that if you don't have like a past experience on something, this field is really not meant for you because you don't know exactly how it feels to go through what they're going through as a patient.
Right. I mean, sometimes, each person has some roadblocks. Whether they choose to identify them or not, is up to them. I actually take, my roadblocks in my life and the dynamics that I had to go through when I was a child as a learning experience and something, like I said, that inspired me to want to be there for other families and help and guide them to better communicate with one another so that they don't become part of a broken home. And, if you aren't able to identify with these families or you're not able to empathize with them. You're not able to put yourself in their shoes. So I think it's important as professionals that do work in the mental health field to kind of reflect on our own childhood and our own past experiences to be better able to understand those that we work with.
What made you choose the college you went to? Like, did you have other decisions from colleges?
Yes, I actually had two or three options. There was Florida State, and then there was Nova, and then University of South Florida. The primary reason why I picked the University of South Florida is because I had heard good things about the psychology program, and I really wasn't sure if I was ready to venture out on my own as well. So I just felt like it was the best fit for me when I went and interviewed for the program. And as far as my master's, I also did my master's at USF. And again, when I did my interview for my master's program with the faculty, it just felt like the right fit for me. It felt like pretty much like home. Like I was comfortable, and it was a school that I knew that I could excel at with my academics.
Nice. So, do you ever plan to? Is it always going to be family, or do you ever plan to do just kids at one point, or you're always going to stick with family?
Right now, I'm kind of just doing what's given to me. Like I said, it's kind of hard to find employment in our field because it is competitive. However, my plans for the future is to gain my license in Florida and open up a part-time private practice and work primarily with children and families. But my passion is primarily with children. So I hope that in the future I'm able to just focus on helping children out.
So you do plan to open your own office at one point so that can happen?
Yeah, I do. I mean, I don't know if I'm going to do it solo. There's a lot of counselors that actually do a group private practice. Mm-hmm. So I've managed to remain in contact with some of my colleagues from my master's program. And, we've discussed ideas here and there of possibly in a couple years once we're all licensed, opening up a private practice and each individual having a specific area or of expertise of some sort, so that we can all feed off of each other and just be able to. It's pretty expensive, so for it to be affordable for all of us.
Understandable. Well, thank you so much for this interview. I truly appreciate this, and I have more information of like where I want to go because mental health lately has been a huge impact, and I want to do it for sure.
Well, that's good to hear. I will say that I think that it will be really rewarding for you, and it is a life-changing experience when you are able to work with these people and see what they've had to go through on a day in, day out basis. And it kind of also is a humbling experience because it makes you realize that maybe your life wasn't as bad as you thought it was.
That's true. Wow. Thank you so much, Miss Bellinni.